Alrighty, Doc, I know we're here at the basketball practice. Thank you for taking time to share with all my folks out there. Can you tell me just a little bit about what you do and why I'm even here talking to you today?
All right. Well, no, thanks for the introduction, for taking a few minutes to come talk to me about technology and AI and medicine. So, I'm a doctor. Specifically, I'm a cardiologist, and even more specifically, I'm what's called a cardiac electrophysiologist. So, I'm a kind of doctor who deals with people who have abnormal heart rhythms, people whose heart rates are going too slow, or who are going too fast. And there are different ways that we treat it, either with devices, things what we call pacemakers, or people who have very fast heart rates. We treat with procedures called ablation procedures, where we find and target the areas of the heart that's responsible for those heart rhythms. And so my field is, heart medicine, heart procedures, very much procedures. A lot of what I do involves doing procedures in people's hearts. And all of what I do is really integrated with technology. Without technology, I wouldn't be able to do what I'm doing today.
Awesome. Now, specifically, you mentioned not being able to do your job without technology. I'm talking to the group today about AI.
Yeah.
So, can you tell me how AI is helping you do your job better?
Of course. So, besides my clinical hat of doing procedures, I'm actually do research as well, and a lot of my research is involving using artificial intelligence. I'm I'm an associate professor in the School of Biomedical Engineering.
Oh, wow.
Because of my research in AI. So there's sort of two ways that we're using AI in our clinical space. One is in using big data, information about your blood work, your medical history, your family history, genetics, and kind of incorporating that to figure out who's at risk for certain diseases. So specifically for myself, one thing that we are worried about, something I'm particularly interested in, is studying cardiac death. You may hear of people, young individuals, even playing basketball, dying suddenly, their heart stopping without any sort of clear reasons. So are there ways that we can predict, like who's going to actually develop this sort of what we call studying cardiac death? And so we've actually been able to do that using not only information about people's blood work, but particularly using imaging. And so using cardiac MRIs of people's hearts, we're actually able to really detail the kind of features on the heart that are responsible for these arrhythmias. And so when we're able to leverage big data, imaging from thousands of patients, we're able to kind of figure out the signatures that are responsible for these arrhythmias. And so we've actually published a number of work right now highlighting this. And we actually have an ongoing study with the FDA, the Food and Drug Administration, to test our technology in patients moving forward.
Wow, that's awesome.
Yeah, and so that's sort of the first part. The second part is in terms of procedures that I do. So like I said, procedures are probably the main focus of my work. I use a lot of technology to do my procedures. And so there's a couple of different avenues that we're leveraging AI and just technology in general to improve our procedures. One is using kind of virtual reality, and so some of our colleagues in other centers are creating